In this section, we're going to look at radiotherapy. Radiotherapy is the using of X-rays to kill cells in the tumour that's for some reason proven to be inoperable. To start off, the students actually need to know the theory first. So to do this, what we'll ask them to do is go down into this right-hand corner and click the Show Theory button. When we do click the Show Theory button, a new window will open. Let's do that now. In this window, the theory is shown about how radiotherapy works. Now, radiotherapy is where we're actually going to use the ionizing properties of X-rays to damage cells. And what we actually want them to do in this case is to kill cells. So when a patient's got a tumour that's malignant and has become inoperable, then the X-rays will be targeted on that tumour to try and kill as many of the cells as possible. Now, the radiotherapist has got the very important task of making sure that the machine is set up to target the tumour and damage the tumour whilst damaging the rest of the body as little as possible. The next point is that the tumour can be irradiated from all possible angles, and this is one of the ways that the tumour is targeted whilst keeping the rest of the body as safe as possible. Another major point is that the radiotherapy treatment will be spread over a period of time and not all given in one dose. Now let's look at the actual simulation itself. We're actually going to get the students to follow the instructions as laid out by the simulation itself. So we ask them to go down again to this bottom right hand corner and click the Show Instruction button. And again, when they do, a new window will open. Let's do that now. So here is the set of instructions as given by the simulation. Now, I'm not actually going to go through them exactly as shown here, but they're very good for the students. I'm going to actually show you myself. So we'll stop this now and move on to the simulation. Now, the first thing a radiotherapist would need to do is, before they switch on the X-rays, they'd need to align the machine. And this is done by using a light beam in this case, but in a real radiotherapy session, it's very likely that a laser beam would be used. To turn on the light beam, we go across to this section of the simulation and we need to click on the button. Now, don't click on the word on, click on the button itself, and when you do that, a light beam is displayed. The light beam now has to be positioned, and to do this, take hold of the slider here, which is going to adjust the Y position. Grab it, click it, grab it, and just drag it down until the beam is aimed at the center of the tumour. Having done that, we now look at the manual rotation over on the right, this button. Grab hold of it by clicking and turning, so keep pressed and turn and move it to 90 degrees. And then we now need to realign with the X button, the X position button. We now need to check that this is correctly aligned, and to do this we turn the rotation from manual to automatic, and to do that over here we simply click on the button again and make sure that it goes to automatic. Now, keeping an eye on that as it rotates, we have to make sure that it's aligned in the center of the tumour all the time, and it does appear so I'm quite happy with that. Now, having aligned the machine by using the light beam, before we actually turn on the X-ray radiation, we need to set the dosage, and that is done by this down here. The dosage rate can be changed by moving this dial. Again, all you do is click and drag and change it to whatever value was necessary. And the maximum dose can be changed over here by using these sliders to move the numbers up and down, or by clicking in, wiping, and just changing the number. Once this dosage has been set, and this of course would be in collaboration with the consultant who'd been treating this patient and would be specific to that patient, and you'll see that the patient we're talking about at the moment is one called Miss Smith. So once that's been set, then everything's ready now to turn on the X-ray radiation. And that would be done by first of all turning the light beam off. So we'd click there to turn it off, and then turn the radiation on by clicking there. And you'll see that the radiation now is being shown, and all the pattern is being given here of where the radiation would be occurring, and you'll notice that it's concentrating in the tumour itself. Now what will happen is the machine has been set to a maximum dose here. So once that dose has been achieved, then the machine will automatically stop. So as the machine is rotating, the dosage is being calculated, and then when the maximum has been achieved, the machine will automatically stop. So if you leave it long enough, that should happen. So let's just watch for a moment and see if it does. There you go, it's stopped. Now we're going to have a look at displaying this information in a slightly different way. So what we're going to do is we're going to clear that by clicking this button down here, clear. We're going to set the rotation going again. And what we're going to do is in a moment we're going to turn on the radiation, and then we're going to change the display from radiation to dose map, and we're going to do that fairly quickly. So let's turn on the radiation and then quickly change the display to dose map. So here we go, and then click that button, and you can see now what's being displayed is the dosage, and you can see just here, which is where the target of the tumour is, the amount of dosage being shown on this scale. So we'll let the whole process happen, and you can see that the dot is getting brighter and brighter, indicating a larger and larger dose. It's almost finished. There we go. Now let's go back to the original display by simply back down to here and clicking the button so it goes back to radiation. Let's clear all this X-ray information by clicking the clear button down here. And of course, if you wanted to, you could allow your students to try different dosage rates and different maximum dosages, but that depends on whether you've got enough time for them to do that. Another thing you can do with this simulation is to switch patients, and that's done by going over to this box at the top left here. If you click on the name, you can see that there are various people. So if we just have a look at what happens when we go to Miss Jones, you can see that this is a fatter lady with a tumour in a different position, Mr. Baker and Mr. Butcher. So if you've got time, you could allow your students to go through the process of realigning the machine, changing the dosage, etc., and seeing the differences with all the different patients. Hopefully then now you've got a good idea of how this simulation works, and you'll be able to pass this information on to your students so that when they've finished, they've got a clear idea of what radiotherapy is and how X-rays can help in the treatment of tumours.